The oxygen cylinder color code in India is A. Black body and white shoulder, B. Black, C. Green body and white shoulder, D. Light blue. And the correct answer is A. Black body and white shoulder. Prothrombin is also known as A. Factor 1, B. Factor 2, C. Factor 3, D. Factor 4. And the correct answer is B. Factor 2. Prothrombin is also known as factor 2. Prothrombin deficiency leads to problems with blood clotting. Bronze baby syndrome is a rare complication of A. Phototherapy, B. Radiation therapy, C. Chemotherapy, D. Blood transfusion. And the correct answer is A. Phototherapy. Bronze baby syndrome is a rare complication of phototherapy for neonatal jaundice occurring due to modified liver function, particularly cholestasis of various origins. Bronze baby syndrome is the dark grey-brown pigmentation of skin, mucous membrane and urine following phototherapy. Hepatic dysfunction has to be there for this condition to be present. Anti-ketogenic hormone is A. Adrenaline, B. Dobutamine, C. Insulin, D. Glucagon. And the correct answer is C. Insulin. Anti-ketogenic hormones are those hormones which inhibit the formation of ketone bodies in the human body. Insulin prevents the formation of ketone bodies. Which of the following gases do not normally participate in any chemical reaction? A. Hydrogen, B. Neon, C. Carbon dioxide, D. Methane. And the correct answer is B. Neon. The eye lens of a human body is A. Biconcave structure, B. Biconvex structure, C. Plane mirror, D. Prism. And the correct answer is B. Biconvex structure. The lens or crystalline lens is a transparent biconvex structure in the eye. Lens along with the cornea helps to refract light to be focused on the retina. By changing shape, it functions to change the focal length of the eye so that it can focus on objects at various distances, thus allowing a sharp real image of the object of interest to be formed on the retina. This adjustment of lens is known as accommodation. Accommodation is similar to the focusing of a photographic camera via movement of its lenses. The lens is flatter on its anterior side than that of its posterior side. The mode of reproduction in which an organism can reproduce without the involvement of another organism is called A. Fertilization, B. Asexual reproduction, C. Spore formation, D. Vegetative reproduction. And the correct answer is B. Asexual reproduction. The innermost layer of the uterus is A. Myocardium, B. Myometrium, C. Endometrium, D. Perimetrium. And the correct answer is C. Endometrium. The thick wall of the uterus has 3 layers. The endometrium is the inner layer that lines the uterus. It is made up of glandular cells that make secretions. The myometrium is the middle and thickest layer of the uterus wall. It is made up mostly of smooth muscle. The perimetrium is the outer serous layer of the uterus. Where is antecubital fossa located? A depression in the bend of the knee, B. A depression in the scalp, C. A depression in the bend of the elbow, D. None of the above. And the correct answer is C. A depression in the bend of the elbow. ART is used in the treatment of A. HIV, B. CKD, C. CVA, D. ESRD. And the correct answer is A. HIV. ART stands for antiretroviral therapy. Antiretroviral therapy is a lifelong treatment, but it can keep HIV infected people healthy and active for many years. It is important to never stop the medication even if the viral load drops to undetectable levels. If treatment is interrupted, the virus is more likely to mutate and become drug resistant. Which is the key hormone that inhibits gluconeogenesis? A. Growth hormone, B. Human chorionic gonadotrophin, C. Glucagon, D. Insulin. And the correct answer is D. Insulin. Todd's paralysis is seen in A. Epilepsy, B. Jaundice, C. Kidney failure, D. Glaucoma. And the correct answer is A. Epilepsy. Todd's paralysis is a neurological condition experienced by individuals with epilepsy. In this, a seizure is followed by a brief period of temporary paralysis. The paralysis may be partial or complete but usually occurs on just one side of the body. What is the full removal of a breast called? A. Breast conserving surgery, B. Mastectomy, C. Breast reconstructive surgery, D. Mastoidectomy. And the correct answer is B. Mastectomy. A mastectomy is a surgery to remove all breast tissue from a breast as a way to treat or prevent breast cancer. Cerebellum regulates one of the following: A. Speech, language, B. Special senses, C. Posture, muscle tone, D. Mental behavior. And the correct answer is C. Posture, muscle tone. The cerebellum is the area of the hindbrain that controls movement, coordination, balance, equilibrium, and muscle tone. Part of skin which contains sweat glands and nerve endings is A. Epidermis, B. Dermis, C. Subcutaneous fats, D. Sebaceous glands. And the correct answer is B. Dermis. The dermis is a thick layer of fibrous and elastic tissue made mostly of collagen with a small but important component of elastin. This elastic tissue gives the skin its flexibility and strength. The dermis contains nerve endings, sweat glands, sebaceous glands, hair follicles, and blood vessels. Chloride shift is also known as A. Hamburger phenomenon, B. Linnaeus phenomenon, C. Both A and B, D. None of the above. And the correct answer is drop your answers in the comment section below. For downloading PDF content and for latest updates, follow our Telegram channel. I have given the link in the description below. If you like this video, don't forget to hit that like button. Thanks for watching.